caused by microbacterium tuberculosis, which is actually related to the cause of leprosy, which was and this bacteria was discovered by Robert Koch in 1882. The human version of TB arose from the bovine version, and according to the CDC, as of 2011, 9 billion people became sick from TB, and 1/3 of the global population is infected with TB. Scientists think that the first cases of TB occurred during the Neolithic period, which was about 9,000 years ago, and there has also been some molecular evidence that Egyptian mummies also contain cases of TB. And in the Old Testament, it is mentioned about a disease that is similar to TB. Hippocrates actually also identified that TB was the most common cause of disease in his time, and TB was also the cause of an epidemic that lasted for 200 years, and it started in the 17th century. It's called the White Plague, and it happened in Europe. And then when Robert Koch came along, he discovered the etiology of TB on March 24th, 1882, using his postulates, and that day is now known as World TB Day to commemorate his work. So, some TB cases among some famous people include Nelson Mandela, who got TB during his prison time, but he was cured. Recently, he's been in the news because he's just been discharged from the hospital after a recurring lung infection. And also, Eleanor Roosevelt also got the disease near the end of her life, so there was not much time to treat it. And Frederick Chopin, a famous Polish composer and pianist, also had the disease and is thought to be treated, but he died from an unknown cause, and some people think that he probably died from a recurring TB infection. The major way this disease is transmitted is through aerosolization, in which the bacteria is acquired by the infected droplets of TB-infected individuals. And therefore, people who live in close contact or are part of a TB-infected individual's family are at higher risk of getting TB. Also, you can also get the disease through non-conventional ways. For example, embalmers getting TB from infected bodies, and you can also get TB. You can also get TB from cows. Cows have this other type of TB called bovine TB, and this type of TB can also be spread to other mammals, including us humans. The cause of this TB is actually Microbacterium bovis, so it has a different species, but the symptoms are actually the same. So you can get bovine TB from unpasteurized dairy products, and dairy farmers, people at slaughterhouses, and veterinarians are at high risk of getting bovine TB. So at first, most of the people who get TB usually have an asymptomatic form of TB called known as latent TB, but 10% of the TB-infected individuals will get active TB. This is because people with latent TB have been found to have these lesions known as granulomas, which are collections of macrophages and immune cells, and these help basically prevent the TB from spreading to other parts of the body, and therefore it results in latent TB. But what happens in active TB is that these people with active TB do not have granulomas, so it lets the TB spread to other parts of the body. Microbacterial tuberculosis invades many parts of the body, including the lungs, skin, and the spine. And actually, in this picture, this is actually a lesion known as tubercle, and they're always found in cases of TB. So there are two types of TB, latent TB and active TB. And there are actually two types of active TB, pulmonary TB and extrapulmonary TB. So pulmonary TB occurs when Mycobacterium tuberculosis enters the lungs, replicates inside the macrophages of the lungs, and causes an infection. It can also enter the lungs through the bloodstream. Extrapulmonary TB happens when it enters the bloodstream and the Mycobacterium tuberculosis can spread to other parts of the body. And this one, extrapulmonary TB is common in children and it is fatal. Extrapulmonary TB is also known as miliary TB because the shapes of the lesions caused by extrapulmonary TB are like millets. Some people actually group and classify the TB infections based on drug resistance, and there are two types of drug-resistant TB infections. The first one is MDR TB. It is caused by antibiotic misuse, and it is resistant to two of the most powerful first-line treatments. One of them was also rifampicin, which was also used to treat, I think, leprosy, and to treat this disease, doctors actually use the PIH model that we learned about in the RX for Survival video we watched. And what are the drug resistance mechanisms we see in these infections? One of them is the change in the cell wall structure. This means that the drugs cannot enter the bacteria and cannot destroy or kill it. Another way is the use of enzymes. The enzymes can break down or change the structure of the drug and making the drug no use. And another one is the use of efflux pumps. There are efflux pumps in Mycobacterium tuberculosis that can pump out different drugs. And the last one is the change in the target structure, which means that the drug does not know where to go, so the drug is no use. Okay, there's also another form of drug-resistant TB known as extremely drug-resistant TB or XDR-TB, and it is caused by the antibiotic mismanagement when treating MDR-TB. And there are not very good treatments out there to treat XDR-TB, so doctors are left with no option but to use MDR treatments, but it won't be that useful because XDR-TB could be resistant to the antibiotics that is used in MDR-TB treatments. And so scientists are looking for more ways to treat this disease, and one way is by using linezolid. It actually treated 50% of the people who use it, but it has bad side effects. So the two main symptoms that are present in a TB infection is weight loss and unexplained fever. And if a patient has pulmonary TB, he'll also have chest pain, prolonged coughing up blood, which is also known as hemoptysis. And if the patient has extrapulmonary TB, the symptoms will depend on the infection site. So, for example, if it is tuberculosis, meningitis, the patient will get vomiting, headache, altered mental state, while if the person has urogenital TB, he'll get urinary types of symptoms, and if the infection site is the skin, then he'll probably get skin ulcers and so forth. here's a small a picture summarizing the different types of symptoms. So the major way doctors use to diagnose TB is the use of a skin test known as the Mattox tuberculin skin test, in which the doctor will insert some fluid called tuberculin into your skin. Tuberculin is a outer membrane protein of Mycobacterium tuberculosis. So what happens is it causes a reaction here known as the BIOL, and what happens then is after 48 to 72 hours they measure this BIOL, and from that they will know whether you're positive for TB or negative for TB. But the major problem with this way is because people who have received the BCG vaccination will not get good test results because the BCG vaccination produces false positive results, and so there people who have taken the BCG vaccination are recommended to do blood tests or chest X-rays. Blood tests are the most preferred TB tests for people who have BCG vaccines, but chest X-rays are actually more cost effective. And as you can see, there's like another tube here. And yeah, they also do sputum cultures too. I think that. So who is at risk of getting this disease? The immunocompromised are at most risk of getting this disease. Examples of immunocompromised people include people with HIV or AIDS, people who are receiving organ transplant recipients, and also cancer patients who are receiving chemotherapy. Other people at risk include people with chronic diseases like diabetes, the very young and the very old, and also smokers and alcoholics. So what can we do to prevent this disease? One way is by avoiding you can avoid spending long periods of time in enclosed rooms with active TB patients. You can also use protective measures like face masks. And if you live with somebody who has active TB, encourage them and help them and encourage them to follow the treatment instructions. The TB vaccination can also help to a certain extent, but it's not useful for adults. So it's a childhood vaccine, and it's not recommended in the US because the risk of getting TB is low in the US. Okay, I'm done. Does anybody have a question? Okay,
Do you, I kind of doubt that you might know about it, but they used to test TB with like these prongs when I was a kid. I don't know if they would dip it in serum or something, but they would actually like stick it on your arm, like on the underside of your arm. They would prong you with it, and if the bump stayed on your arm or something like that, then you had TB. And I don't know if anybody else remembers this, if it's just me, but now they do the fluid into the skin, and if it dissipates, then you don't have it. Do you know why they changed the testing, or do you know anything about those previous testing methods?
I don't know anything about the previous testing, but I think the reason they're doing these tuberculin skin testing is it's easier, and it's a lot easier. But again, as I said, it's not useful for people who have received the BCG vaccine. But I think that's the main reason, because all they have to do is inject it in there and then wait for some period of time, and then you're done. But again, as I said, there is a problem with the BCG vaccine, so they would also do blood tests and chest X-rays.
So how likely are smokers to get it? Are they like way up there on the scale, or are they just sort of?
Kind of.
It's real common in prison, wherever you're in close contact
Yeah.
with people, like prison situations where. But you're,
Like how I said, Nelson Mandela got it during his prison time because he probably was in close contact with somebody who had TB.
So if you smoke, stay out of prison.
I'm staying out of prison for different reasons.
Over there?
Yeah. What made you choose TV everything else?
Okay, I forgot to say it, but the major reason I actually chose TB is because it was one of the top 5 infectious disease killers. So that's why I chose it. It's very important.
Oh,
Over
that's
there?
scary.
That's not a question, but more of a comment. You did a great job.
Thank you.
You did a great job, man. 9 years old, standing up here in front of all those people that are probably double your age. You certainly did a great job.
Thank you.
Yes, tuberculosis, a third of the population of the world are carrying it. And recognize too with tuberculosis, if you don't have an active form of the disease, you can't transmit it.
Yeah.
Because it's, like you said, in those tubercles, it's closed off, and so you're not coughing it up. But it can turn active if your immune system is lowered, you start smoking, weaken the lungs, anything like that, get old, those types of things. So really nasty disease. They're really working on a better vaccine.
Yeah, it's not very useful.
I know, the one that they just tested wasn't much good, was it?
Yeah, and plus, you can't give it to adults, it's not for adults, so it's all
Well, the-
childhood, so.
Yeah. Well, that's the BCG, but they tested a recent one. When was that? Now, the BCG, yeah, is the one that isn't useful for adults, and it's also not even real super good in kids. It's not a real great vaccine, so they're really trying to get a better one.